So this idea of the tiered approach, again, we really need to be thinking about how can we embed and grow generalist palliative care into our systems. And I see this as a great opportunity for primary care physicians as well as specialists who continue to almost act in a primary care mode. And being an internist at heart, this is particularly encouraging to me that these folks could be very much involved and part of the interdisciplinary team providing generalist level palliative care. And then the consultations that are perhaps much more complex or an opportunity to learn new techniques from the palliative care specialist is what would be triggered by accessing specialty level palliative care. And as Eitan reinforced over and over again, this really needs to be a coordinated and intentioned process. We need to be thinking about how we do this within systems of care. There really should be also a thoughtful consideration of returning that patient to the primary care physician or to the specialist that referred them. We don't need to add additional layers of specialty care and further fragment our care systems. This is an opportunity, again, to layer on more support, but not necessarily to compete out other aspects of support. And this is a great opportunity with this idea of generalist palliative care to do that. It allows then the specialist to be available for the complex problems and not to be totally consumed by managing large populations of patients. So here too is quality, using the right resource at the right time in the right way, and that therefore more patients and families would have access to supportive care. So this really simplifies, I think, healthcare. It defines the team in a very vibrant way. It reinforces existing relationships. It adds to education. Consulting for physicians is the way we learn new skills after we graduate from residency, and it helps to reinforce those skills and helps us improve our ability and capacity to deliver excellent palliative care for our patients and families. And it helps to really protect and enhance and nurture important relationships. Certainly, I think all of us know that it is about relationships, and particularly for these patients in the continuum of care, those folks who are confronted with serious illness, their families, it's very, very important that their care is not fragmented, that they feel they don't have to keep telling their story over and over again, but rather they are understood and people are working on their behalf. And by doing this, by coordinating this and creating better team, we actually are going to be able to decrease costs. Again, we're not just layering on more specialists, more people, but we're really actively collaborating and co-managing. And this model of generalist plus specialist palliative care is really what is evolving worldwide and is being endorsed worldwide. It makes the most sense. It allows us to use our resources more effectively, and most importantly, it's going to benefit patients and families in a very powerful way. So as we've covered here, and we're going to open it for questions very soon, again, we are all challenged to pursue this triple aim. We're all about, in our health systems, in our conversations, how can we improve the experience of care? How can we manage better the health of populations and at the same time decrease the cost of health care in the U.S., which has skyrocketed? And we understand that particularly for this vulnerable group of patients with advanced illness and serious illnesses, palliative care has particular expertise. And there aren't enough of us, so how can we then drive the evolution, development, sustainability of primary care competencies, primary palliative competencies into the fabric of health care? And this amazing project that we've been a privileged part of is demonstrating its impact on just basic communication skills training and how it can facilitate quality improvement, how it can actually change the culture of institutions. And this speaks to this coordinated palliative care model and how it can effectively deliver more generalist palliative care.